Another Friday in the books. You have tuned into NBCLX. It is January 22nd. I'm Tabitha Lipkin and my co-host, JoBeth DeVera. There you are. She's joining us from home as we continue to adapt during the pandemic, which takes us right to what President Biden is currently doing. He's wasting no time implementing a new framework to help curb the spread of the virus. Yesterday, he unveiled his national strategy, and here's what he had to say.
Let me be very clear. Things are going to continue to get worse before they get better. The memorial we held 2 nights ago will not be our last one, unfortunately. The death toll will likely top 500,000 next month. The cases will continue to mount. We didn't get into this mess overnight. And it's going to take months for us to turn things around. But let me be equally clear. We will get through this. We will defeat this pandemic.
And let's talk about how President Biden plans to accomplish this. He's already signed several executive orders that align with a 198-page national strategy to combat COVID-19. The president is promising to increase the number of vaccination sites by creating federal community centers in stadiums, gymnasiums, and conference centers. The locations will be staffed with thousands of additional workers, and FEMA is being directed to increase federal reimbursement from 75% to 100% of the cost needed to create these centers. President Biden says he expects at least 100 new centers to be set up by next month. JoBeth?
Yeah, that's right, Tabitha. He also says that he is equally focused on speeding up production of vaccines, and one way is by using the Defense Production Act now to provide more federal funding to manufacturers and to ramp up supplies of mass testing kits and vaccine materials. And as vaccine production improves, President Biden is encouraging states to provide vaccinations to people 65 and older, along with certain essential workers that include teachers and grocery store employees. However, one thing the Biden campaign is warning us about is a previous promise made by the Trump administration. They say, unfortunately, vaccines won't be widely available at retail pharmacies like the flu vaccine by late February. However, the president is implementing more protocols in efforts to keep everybody safe.
One of the executive orders requires us to wear masks on airplanes, trains, and other forms of public transport. It also mandates people test negative before flying to the United States and quarantine once they get here. Biden says that he wants the majority of K-8 schools to be open in his first 100 days. And to make that happen, he signed he signed something that would reimburse schools for additional cleaning, protective equipment, and other costs associated with getting students back to the classroom. The president also reiterated that his ultimate goal is to get 100 million vaccinations into people in his first 100 days in office. But in order to do so, he says it's going to require everyone to hold themselves accountable and each other accountable.
One of our 100-day challenges is asking the American people to mask up for the first 100 days, the next 99 days. The mask have become a partisan issue, unfortunately, but it's a patriotic act.
Now, President Biden has taken office at a very pivotal moment in the pandemic. Nearly 3,000 people are dying every day. That's according to Johns Hopkins University. And newly discovered strains of the virus are establishing footholds right here in the U.S. So how exactly will Biden and his team accomplish their goal of 100 million doses in 100 days? How will that process look like and the logistics of it all? To help us get a better understanding, joining us today is Nikolay Osadchiy, the Associate Professor of Information Systems and Operation Management at Emory University's Goizueta Business School. Nikolay, thanks for joining us today. So what do you make of President Biden's plan to tackle the spread of the virus? What do you think of it?
Well, I think, it's important to address this pandemic. And this is a complex issue. And the logistical side of it is indeed a very complex process. It has multiple steps. It starts with manufacturing vaccines, then delivering it into the states, then to the local health department, then to the vaccination sites, and then putting it into people's arms. So as we progress, in this process, we have different challenges. If you think where we were maybe 1 month ago, we were thinking about manufacturing capacity, we were thinking about cold storage. Now those challenges to a large degree have been addressed. So now the challenge seems to be putting it into people's arms, and we are working on it right now. And the vaccination sites are expanding, and we expect progress in that. So with that, we need to also be prepared for the future challenges. So I think the process is working. The vaccination, there is definitely a learning curve, but I would say we're much better now than we were 1 month ago, and hopefully the progress will continue.
Okay, so we know some of the COVID vaccines require, special conditions for transport, for storage, and for distribution. How will the supply chain have to adapt with all of the demand?
So we have to be prepared, right? We need to basically coordinate the supply chain. We need to make sure that the vaccine is available at the manufacturing sites in sufficient quantities. Then we need to make sure that there is sufficient trucking capacity, air freight capacity to deliver it to the states, and then that there is sufficient healthcare personnel to be able to administer it and put it into people's arms, and make sure that there is no waste of vaccine and no waste of precious time of healthcare professionals. So these are the challenges I think we're adapting. There are some solutions that we could implement also to make the process better. For example, one straightforward solution just to increase the number of healthcare personnel. There are also some more subtle solutions to the process, maybe overbook a little bit, like learn from airlines, and overbook the vaccination slots, because there is an issue of no-shows, right? So we want to reduce this wasted capacity at the vaccination sites. So things like that, and that's the way to adapt, I think.
Okay, you mentioned doing things like what the airlines do in overbooking flights, and you're saying overbooking appointments is one solution. That was actually my next question, because we've heard about some people booking appointments to get their vaccinations, and then they still wait hours in line, and then sometimes they're eventually turned away. So how else do you believe the whole appointment system can improve in this?
Exactly. It's, you cannot really go into overbooking before you get your, the process straight. We need to start at the very beginning, and we need to make sure there is a capacity first, right? So if you don't have personnel and the time available to put vaccines into people's arms, there is no point of overbooking. But once we get to that point, and once we get to the point when people's no-shows become an issue, that could be a solution.
Okay, well, we'll have to wait and see how this COVID-19 plan plays out from President Biden and his team. Nikolay, Osadchiy, thank you so much for joining us today.
Thank you, GBS.